Hello, welcome to the board summary video for the last board meeting that took place on the 26th of February. As normal, we started our board meeting with a patient story, and this month's patient story focused on life after cancer treatment, but particularly rehabilitation services. And we heard about a programme that was run by Stoke Hill, which is a small holding in South Somerset. Debbie Hicks, who is the director of Stoke Hill, attended the board along with a patient who talked to us about the benefits of the workshops that they run, which include walks and craft therapy, and the impact that that's had on their life. The service at the moment is relatively small scale, but is linked to the YDH oncology unit and is being evaluated by the AHSN, and we're working together to look to see how we might be able to support similar initiatives and scale up the service and the offering from Stoke Hill in the future. As usual, we also had a departmental video, and this time we focused on a day in the life of a nursing associate. This links to our work around the International Year of the Nurse and Midwife, and also is part of a YDH podcast series, which you may have heard, and is available via our own podcast channel. So if you want to hear more about that, have a look on the podcast channel, and over the coming year you'll hear a number of day in the lives of various staff around YDH. We moved in our executive report to focus on the operations of the hospital. I think it's fair to say there's a lot of activity going on at the moment, both given the level of emergency demand, which remains high, and the planning for COVID-19 coronavirus. We are regularly breaking records at the moment on the number of attendances to the emergency department each day. The hospital, I think, is generally coping well with with that, but there is significant pressure, particularly in ED, and we're looking forward to now progressing with the capital build, which is just about to start following additional resource that we had from NHS England just before Christmas. And we're also, as part of the planning for the new financial year, undertaking a review of staffing levels in ED, but also across our medical services. The board were brought up to date with the plans around COVID-19, which is being coordinated via our emergency planning function. The situation is moving quite quickly. There is a lot of guidance, and I would urge you, if you want to find out more, to look on our YCloud page for that, for the most up-to-date information. We also focused on our CQC maternity survey, which took place in January and February of last year. Had great results, both actually at YDH but also at Taunton, which shows the strength of our maternity service across the county. From a YDH perspective, some of the headlines were related to women feeling that they were involved in decision making about their care, some good feedback around discharge information, the fact that people felt that they were being treated with dignity and respect. And I think all of this comes on the back of last year's extremely positive CQC inspection. The board also noted the ongoing consultation around inpatient mental health services, an engagement process around community, the future of community care, both of which are part of the Somerset-wide Fit for My Future programme, and also our plans in YDH for celebrating the International Year of the Nurse and the Midwife here in 2020. We also had a presentation on the developments across the county in mental health services. This was provided by Andrew Keefe, who is the Mental Health Commissioning Lead for Somerset CCG. Andrew set out the plans to develop mental health services in line with the long-term plan, and this follows a successful bid by Somerset for £17 million worth of new monies, which will come to Somerset over the next 3 years and enable us to become a trailblazer for new services in the southwest. Our particular focus is on extending our home treatment service and our psychiatric liaison service, both of which are up and running, but also developing tier 2 services and focusing on prevention, which includes services around talking therapies. A key theme is the concept that there is no wrong door for people with mental health difficulties, and that we blur the boundaries between those services by having a much more holistic offering. This, I think, is a real opportunity for Somerset to move forward with our mental health service offering. As usual, we focused on our performance quadrant. Operational performance and clinical quality performance remained strong across the board. We had a detailed presentation from Sarah James, our Chief Finance Officer, around a financial governance review which took place at the end of last year and was a response to our inadequate rating in the use of resources review as part of our CQC inspection. So the board took stock, reviewed the key actions and actually critically the progress that we have made since then, and this will be a source of regular updates to the board over the coming months. Sarah also gave us an update on our 1920 financial position. We are predicting at the moment that we will hit what's called our control total, which is a £19.8 million deficit this year. If we do that at the end of the financial year, we achieve £19.8 million worth of additional income, which would effectively put us in a break-even position, again, which would be a massive achievement for this organisation this year. Doesn't belie the challenges as we go into 2021, into the new financial year, but I think would be a great step forward for us this year. And we finished the meeting with a presentation from Mark Appleby, Mark Appleby, the Director of Human Resources and OD, on the staff survey. And again, just to give you some headlines on that, we had a 72% response rate, which was great, 1% higher than last year. Some of the headlines: we were the highest in the country against the scores around health and well-being, and also around support from immediate managers, both really positive. And we also were relatively high on the scores around staff morale, engagement and team working. It was pleasing to note that actually, as well as the response rate, we had scored significantly better than the rest of the sector in 82% of all of the questions asked across the survey. So there's some real cause for celebration there. I think one area of focus, and an area of focus for the coming year, will be appraisal, and particularly the quality of appraisal that takes place here. So that'll be the area of focus for the coming year. So that's the board summary for February. In March we have a board development day, so there isn't a formal board meeting. So I'll be back again at the end of April for an update on the April meeting. Thanks.